I interviewed Dr. Nikhil Garg on Zoom on November 29th. I interviewed Dr. Reeya Sannake on Zoom on December 1st. I present this content to UNANA Global Health students on December 8th. Hi, my name is Reeya Sannake and I'm doing a presentation on family medicine, and I'm in Region 18. So, what is family medicine? It's the branch of medicine that is designed to treat all the members of the family. That is what our dictionary definition is. What is it in general? It is a family medicine is a person who treats all ages and genders. It is a comprehensive and it focuses around the patient's family. What are the steps to becoming a family medicine physician? You need 4 years of bachelor's degree, you have to take the MCAT exam, and you have to earn a medical degree, which is 4 years. You have to pass the United States Medical Licensing Test, the USMLE, and you have to complete a residency program, which is 2 to 3 years, with the optional fellowship program. These are the suggested courses to take in your bachelor's degree from freshman to senior year. You can major in anything you want during your bachelor's degree. After your bachelor's, you have to take the MCAT. This is what the MCAT looks like and what are the sections and the breakdown of each section and how long is it and what are the tests. After the MCAT, you'll get into medical school. In medical school, you can see the courses and you can pick which specialty you want to go into. These are some of the courses as a family medicine you can take. After med school, you have to pass the USMLE medical licensing test, which gives you the license to work wherever you want and practice that family medicine. These are the steps, and this is the format and other info. You have to pass all 3 steps to get your license, and you can see what the breakdown is. After the USMLE program, you have to do residency, but there's also something called dual programs, which is a BSMT program, BSBO program, BAMD program. These can give you a bachelor's and your master's in 7 or 8 or 6 years, but these are highly competitive. There's also something called dual board certification, which gives you the ability to certify in another specialty while also being qualified for family medicine. So what are the jobs in family medicine? Well, after completing residency or fellowship, there are many different paths you can take. You can practice privately in your own clinic or work with other specialties. You can do joint practices, or you can work in hospitals and practice part-time. Many different things you can do, and depending on your working environment. So these are the salary in each state of what are the salaries of each of family medicine doctor in each state. As you can see, Alaska, Washington, Montana, Wisconsin, Alabama are in high need. That's why their salaries are high. So what do you mean in demand? Well, family medicine has become the most in-demand medical specialty. For example, in India, there are roughly around 560K family medicine practitioners. This isn't enough, and they need more to fulfill their population. And yes, family medicine has become the most in-demand medical specialty in the globe. So, in a research done by the AAMC suggests from their demand and key findings is that they conclude that by the year 2033, there will be a shortage of 21,000 to 55,000 physicians. If the population shows these same patterns, then the demands could rise up to 75,000 to 145,000 physicians. As you can see by the graph, they can show how it was increasing per year, and it would increase more. This is also a demand from 2015, where it shows that the demand was constantly growing and is growing very much this year. So moving on from all the demand, let's see the everyday life of a family medicine doctor. This woman explains very good of how her everyday life as a family medicine doctor looks like. She shows her work life, her work ethics, some of her work life including taking notes, patient calls during COVID, also how to interact between one-on-one patient, how it feels and how it is. Financial implications of family medicine. Well, there are many financial gains. There's also financial losses. Some of them include losing your practice, missing one fee-for-service visit, which can accumulate to 50,000 losses. Family physicians estimate lose about 10,000 per year from undercoding. And from today's point of view, COVID and the disparities has brought a lot more financial implications. So I interviewed 2 doctors who shared their viewpoint. So this is Dr. Nilesh Kishore and why he chose family medicine. I chose family medicine because I wake up with a new hope every day to treat and inspire people to take care of themselves. Seeing joy on people's faces is a feeling of happiness. I have patients that I've known since they were a baby, and they make me feel a part of their journey. They believe in me, they count on me to treat them and help them. They, they believe I can give them the happiest and healthiest life. This is why I chose family medicine. Not for me, but for them. This really is very inspiring, and when I was doing his interview, it was felt really inspiring as well. Dr. Nabil Garg, I asked this question. What was one moment that made you realize that you made the right decision in becoming a family medicine doctor? One moment when I was in a government hospital, his response was, one moment when I was in a government hospital giving my service to poor people without any money. They treat me like I was their savior. And that feeling inside you when you become one of this, it is the most prized feeling you can ever feel. It is one of the things that not a lot of people get to experience. This. So it is a very special feeling. Also interviewing, I asked them, how do you believe family physicians are advocates and leaders in addressing health disparities and health equity? Well, Dr. Nikhil Garg said, yes, they play a big role because family medicine are respected within the people and connected to every specialty since each family medicine doctor directs each to a different specialty doctor. And they also follow our guidance. There are many disparities, such as diversity. You can see from the graph that American and Pacific Islanders are the ones that are most not represented in family medicine or internal medicine, and all residents too. In gender role too, male dominate the family medicine here. You can see in the North American medical schools, majority of their residents are male dominant. To end off, I would like to show this quote. The good physician treats the disease. The great physician treats the patient who has the disease. This really spoke to me and it made me feel what I wanted, made me feel like I want to do this thing. So, is it for me? I already addressed it. Yes, I am thinking of doing family medicine as one of my specialties. After researching, after doing interviews, it really was a good thing. And I also shadowed in one of the family medicine physicians, and I was following everywhere she goes. And it made me realize that, yeah, I want to do this. I want to have these one on one personal conversations. I want to take notes and I want to help them be better. I want to be them as part of their family member. I want to introduce them and then I want to be part of their family. And yeah, it is a very unique feeling and I definitely would consider it. Thank you for listening. These are my references that I use.